What's up, guys? Dr. Webb here, orthopedic spine surgeon here in San Antonio, Texas. Healers and Hustlers is a new series that will be showcasing and highlighting various professionals in the medical field who are also entrepreneurs. I encourage you to sit back, take notes, and learn everything about business and medicine that they don't teach us in medical school.
Hey, Dr. Patel with Hillside Primary Care. I'm a board-certified internal medicine physician, and we're here in San Antonio, Texas, at my Shirts location. Primary care is where you build relations. Primary care, the first encounter with the patients. I love building relations with my patients, and that's where it really brought me into the primary care setting. A lot of times when we're part of patients' care in their most difficult time of their life, but also at their most rewarding part of their life. I've had patients that come to just give me a hug on their most joyous day when their child got into a college, or at the worst time of their life when they lost their family member and just needed, again, a shoulder to cry on. So building relations is what really has been the most rewarding. Communication skills is the most important, and being able to relate to your patients in their own setting, trying to understand culturally, trying to understand what they may be going through in their own life is super important to relate to the patient. Doesn't help for us to have incredible amount of knowledge, but not be able to share the same knowledge in their own setting. Some of my patients know this. I migrated to the United States in 1998. A 9-year-old child came from India to United States. In 1999, a year later, my parents were blue-collar workers. A year later, I became very ill and needed to go to the hospital. And again, like I said, my parents were blue-collar workers. They worked. My mother worked as a greeter in Walmart. My father worked in a company. He was a picker where he picked up medical supplies and loaded it to the truck. So, struggling family, to say the least. And he ended up getting a $300 ER bill. That doesn't seem a lot right now, but because all of us get thousands of dollars worth of ER bill. But back in 1999, that was huge. And my father was so stressed out. I remember that I took it to his primary care, my primary care doctor, another Dr. Patel, and the Dr. Patel just ripped the bill and just threw it away. I mean, that was a moment where I realized the power that he had to make a difference on someone's life was incredible. And that's what really inspired me to become a doctor, to be able to hopefully, even if I can get that one other child in my practice to go join this journey, that would be success enough for me. Honestly speaking, thrown into starting my own practice, I moved from Evansville, Indiana to San Antonio for my father's health reasons, and some of my patients know of this, that started with me when I started the practice. And I didn't know exactly what I wanted to do, so I said, okay, well, let me start my own private practice. And I did. With God's grace, with the community support, we were very successful even through the COVID times. But it was more so my father's health reasons brought me to San Antonio. Now, looking hindsight, this was my purpose of coming here to do what I'm doing now. As far as going from one practice to multiple locations, the right place at the right time is one of the reasons. We saw a huge need of migration of people coming into the area from different states. So that was one of the reasons, but also the need. Before I started the practice, patients were not able to get into their primary care doctor for 3-4 months. Even established patients were not able to get into their primary care doctor for 3 to 4 months. I thought that was, to be honest with you, ridiculous that patients were not able to go to primary care. So we grew, and then of course as we continue to grow, we just started adding more locations and added more providers to the practice. I think the biggest challenge was administrative tasks and being able to stay on to see patients on day to day. For me, it was a little more easier journey than others face because my spouse, my wife, is the practice administrator. She's the one who runs the entire practice. So I think that's how we alleviated that issue, was by making sure someone that I could trust was running the practice, and I was still able to hang on with the clinical aspect of it. So the marketing wise for primary care, or for actually for that matter any other doctor, in my opinion, in any specialty, word of mouth. Word of mouth is such a huge marketing for us. Our patients are our advocates. You take care of the patient to best of your ability, and they will go and refer the next 5 more to you. Of course, in this day and age, I did take advantage of social media as well, where Google is a huge help. But even with that, it's going to be more your word of mouth. Your patient that comes to you will go and talk to 3 other patients, that potential future patients, who will go and Google you to learn more about you. So I think they both go hand in hand, your word of mouth and your Google reviews. Do it. I mean, we always complain about, I wish it was this, I wish it was this. Who would have more autonomy over their own practice than their owner? So I think I strongly advise all of my students to use me as a resource for my students at least, but go and open up your own practice. It's hard work, don't get me wrong. I'm not going to take that away. But doing clinical and doing administration both together, it's hard work, but it's so rewarding to see that you are actually making the change that you intended to. But also you'll learn that some of the changes that you're looking to make may not be feasible, but the only way for you to really know that is by trying it. So absolutely go open up your own practice and try it. What's there to lose? Maybe a year of your life, but it's so rewarding. And I'm not seeing any doctor that have not succeeded. You can't be the next one. Yeah, so day in life of Dr. Patel, I've asked some patients to come join me that get frustrated on the efficiencies of the system. But day for me starts out by dropping off my children first thing in the morning, because at the end of the day, my family matters to me the most. But dropping off my children and coming to work, I start seeing patients from 8 to 12, doing some administrative tasks from 12 to 1, hosting meetings, etc. And then going back into patient care from 1 to 5. I do believe in quality of life over everything, not only for myself, but also for my staff, my employees, my other providers. So we all try to finish at 5 and then go back to our family for the rest of the evening and to start the day all over again at first thing in the morning. Yeah, hey, thank you so much for taking a minute to listen to me, to see what my journey has been and where we are, where we're going. If I can be of any assistance to you, your family, my practice could be of any assistance to you or your family. We have over 10 locations. Our patients can get in within 24 to 48 hours. Go to our website and request an appointment.